First of all, thank you for inviting me and present a very interesting topic. Uh, I'll be speaking some cases that is on honeymoon impotence and the role of PDE5 inhibitors in management of honeymoon impotence. I am going to present only three cases, and as I am a psychiatrist, I will be presenting the comorbid psychiatric conditions which is associated with honeymoon impotence. So let's start with the first case. क्या करे या क्या ना करे. So he was Mr. Raja, a 23-year-old male who had come to us with chief complaints of inability to achieve erection on his first night. As everyone had told to him that first night is a very important night, honeymoon night, you should be performing very well, and the wife should be impressed by your performance and all. So hearing all these things from his friends, he was already very much anxious as he was marrying it for the first time. He had no previous sexual encounters also. So he was very much anxious. He had palpitations, tremors, increased sweating before going to for his honeymoon. So this is a classic case of performance anxiety. We diagnosed him as having performance anxiety. We counseled him, taught him relaxation technique also, and to treat or control the anxiety, a tablet combination of propranolol 10 milligram and clonazepam 0.25 milligram was advised to be taken 1 hour before the scheduled intercourse. This he has to take it daily, 1 hour before the intercourse, and also initially for 3 to 5 sexual attempts, we had advised him to take tablet tadalafil 20 milligram 1 hour before the intercourse. Though he did not have any erectile dysfunction problem or any history of erectile dysfunction, just to boost his confidence, tablet tadalafil was advised for initial few attempts. So this is the classic case of performance anxiety and causing problem in the honeymoon night. Let's see the second case. Badi mushkil hai. Now here, Mr. Vijay, he was 26-year-old male. He was diagnosed as having major depressive disorder, and he was on treatment with antidepressants for almost 6 months. He was well maintained on his depression symptoms with tablet escitalopram 20 milligram. It is a class of SSRIs, that is selective serotonin reuptake inhibitors, and tablet desvenlafaxine 100 milligram. It is a class of SNRI, that is serotonin norepinephrine reuptake inhibitor. Now, with these medicines, his depressive symptoms were well under control. He got married, but on the honeymoon day or the honeymoon night, he did not get proper erection. He had not revealed to his psychiatrist that he is getting married, and he had never come for this complaint of erectile dysfunction. But he said, yes, the problem had started after starting the antidepressants. But he thought that once he get married, the problem will get corrected. But unfortunately, on the first night, he realized that he was wrong. So he consulted his psychiatrist. The psychiatrist stopped his escitalopram and desvenlafaxine. SSRIs are known to cause erectile dysfunctions. SNRIs, though not much prevalence, but still they are also known to cause. So we shifted him to vilazodone 20 milligram. Now this is a newer antidepressant. It is a category of SPARI, serotonin partial agonist inhibitor. So the sexual side effects which we see with SSRIs and SNRIs are not seen with this SPARI category of this drug. So vilazodone 20 milligram, it's a good antidepressant with no sexual side effects. And also to initially, as he was newly married and he was to have sexual encounters more frequently, tablet tadalafil 5 milligram was given daily basis for at least 1 month. So this was the second case, drug-induced erectile dysfunction causing problem on the honeymoon night. Coming to the last case, nahi ye ho nahi sakta. So now let's see what was the case. Mr. Badal, a 28-year-old male. Now he had got married 7 days back, and then he came to us with complaints that he could not perform well at the first night. He did not have any erectile dysfunction. He did not have any hyposexual desire disorder. But the problem was that wife had an history of reduced sexual desire, and there was no other psychiatric complaints in the wife. And as she was not cooperative and all, she did not have desire and all, so he also was not able to perform on the first night. So then counseling of the couple was done. All the theories was explained to them about the human sexual response cycle, and the importance of desire to have a good sexual relationships was explained to both of them. And the wife was advised tablet ropinirole 0.5 milligram twice a day, and an herbal preparation which improves the desire was given to her. Now, tablet ropinirole is a dopamine agonist agent. Now, dopamine is a pleasure neurotransmitters. So, if you increase dopamine, the pleasure is also increasing, and the desire to have sexual intercourse increases. And it's widely used for hyposexual desire disorder, and a herbal preparation of arginine and fenugreek was advised. And SOS, husband was advised to take tablet vardenafil 20 milligram to have the boost of confidence in his sexual intercourse. So these are the three cases of honeymoon impotence we come across in our day-to-day practice. Various treatment options are available apart from PDE5 inhibitors. There is definitely sex therapy, counseling is done, intracavernosal injections, anti-anxiety medications are the various modalities which are available for treatment of first night ED with variable success. Studies have shown that just PDE5 inhibitors like sildenafil used alone or in combination with other therapies treat 96% of the honeymoon impotence. And PDE5 inhibitors are known to resolve the great deal of frustration on the part of the patient as well as the physician treating these patients with psychogenic erectile dysfunctions. So just a psychological benefit is there, and the patients perform well. Tadalafil also acts samely, and it also helps in the management of honeymoon impotence. It also breaks the performance anxiety cycle, and a good response is seen with tadalafil also. They are not. There are some side effects of using these medicines. Commonly, headache, flushes, dyspepsia, visual disturbances, nasal congestion or nasal rhinitis. Also named as honeymoon rhinitis. The PDE5 inhibitors misuse particularly or overuse is known to cause nasal stuffiness, that is honeymoon rhinitis. A unique side effect just I would like to say is nasal bleeding can be seen with use of sildenafil and tadalafil because they are known to inhibit the collagen-induced platelet aggregation, and thereby it causes bleeding, particularly from the nose. Sometimes from varices, bleeding, cerebrovascular hemorrhage or hemorrhoids can be seen. These are a couple of references from which I have prepared my slides. In the end, golden words: there is always another chance for everything in life. But the fact is that there is no chance for another life. So make it, mean it, and enjoy it. And this holds true for even the honeymoon night also. So thank you for patient listening. Thank you, organizers, for giving me this chance. Thank you.